Hi, this is Dr. Shurpanini from United Medical Group. Topic for today is influenza, or the seasonal flu. Our first encounter with the flu was actually back in 1918 when the influenza virus was first discovered and commonly referred to as the Spanish flu due to the fact that Spain was not involved during World War I and did not censor any information around the flu outbreak. Influenza virus was discovered in 1918, which was a swine flu virus, H1N1 strain. This virus caused the most deadliest pandemic in our last 100 years. People refer to this as the Spanish flu. This virus was responsible for close to 50 million deaths worldwide and 700,000 deaths here in the United States. The first recorded case with influenza virus during this period was in a soldier at a U.S. Army camp in Funston, Kansas. The patient presented with high-grade fevers, almost 104 degrees Fahrenheit. This virus spread rapidly through the United States, especially in areas related to troop movements during World War I. The Spanish flu rapidly spread into Europe, affecting parts of England, France, Spain, and Italy. This is a time when infection controls such as quarantine protocols, face masks, and distancing were not really well followed. The Spanish flu ultimately came back in a second wave, resulting in more deaths and morbidity. It affected all age groups and, in fact, when encountered with the Spanish flu, in some cases resulted death within 24 to 48 hours. Flu virus can be divided into 4 subtypes, A, B, C, D. A is known to occur in 2 strains, H1N1 and H3N2. Both are considered to be more virulent and therefore can be deadly. While subtype B can also infect humans and has been subdivided into 2 lineages, Yamagata and Victoria. The other subtypes, C and D, have not been shown to be significantly relevant to flu infections in humans. C generally can infect humans, but only causes a mild illness, while D is only observed in cattle. One can easily break down the name of a flu virus into 5 components, which include where the virus was located, the type of virus, is it influenza A, B, C, D, the subtype, is it H1N1 strain, and what year it was discovered, and an arbitrary strain number. Flu origin should be broken down into the host type, which includes animals and geographical. When you think about animals, you should think about categories of animals like avian, birds, swine, pigs, chicken, equine, horses, and geographical implies human transmission. This origin classification helps us break down flu strains with appropriate associations. Usually you come across names that have the designation seasonal flu, which usually implies it's human transmission, while transmission from animals to humans usually have the designation avian, swine, or chicken. So some important dates to remember with flu history include 1918, which was the first exposure to the flu virus, 1930 when we discovered the flu A and B strains, 1952 we had the H2N2 flu outbreak, 1966 was when FDA approved amantadine to use against flu A virus. 1968, we were dealt with another pandemic caused by the H3N2 flu outbreak which is a subtype of flu A virus. In 1970s, we had the H1N1 swine flu outbreak, again another flu A virus outbreak. And in 1999, we received FDA approval for oseltamivir and zanamivir antivirals that can be used for flu. As we all know, history repeats itself. We again dealt with another H1N1 flu pandemic in 2009, which lasted for almost a year, similar to the 1918 outbreak but with a different strain. But the flu pandemic happened in 2009, which was again an H1N1 strain, which is a subtype of Influenza A, similar to the 1918 Influenza A H1N1 outbreak. Now, having reviewed these flu milestones, we're able to build a framework for how flu operates and returns every season in terms of mutated strain, and how we can combat flu viruses by recognizing symptoms at the early onset, which include fevers, headaches, chills, body aches, fatigue, sore throat, cold symptoms, sometimes even nausea, vomiting, diarrhea. Timing is everything. This is more applicable even to the flu virus. The reason why timing is important, because when a clinician recognizes patients with flu symptoms within 48 hours of onset, they can benefit by receiving medications like oseltamivir or zanamivir to decrease the replication of the virus and completely eliminate the virus from the system. We also recommend treating patients who've been exposed to those patients who are confirmed flu positive with a prophylactic dose of oseltamivir or zanamivir in order to prevent onset of flu symptoms and a potential flu infection in these exposed patients. The flu vaccine is usually a quadrivalent vaccine. It generally contains antigens from 2 influenza A viruses, 1 strain from influenza B virus, which makes up the whole composite for the flu vaccine. The 2019-20 virus includes antigens from Brisbane, Kansas, Colorado, and Phuket. The point of emphasis in flu treatment includes early detection and treating patients aggressively with fluids, over-the-counter medications like Tylenol, Cold, Dayquil, NyQuil, and also administering medications like Tamiflu within 48 hours of symptom onset in order to improve their chances of full recovery from the flu. One of the newer treatments recently approved in 2018 was Xofluza, which has been effective in treating flu patients if given within 48 hours of symptom onset. The main differentiating factor between Xofluza and other medications like oseltamivir is that this is a one-time treatment as opposed to twice daily for a few days like with oseltamivir. My final points about flu are to recognize symptoms at the early onset and seek medical attention right away. Try to maintain universal precautions. Wear a face mask, cover your sneeze, social distancing, wipe down hard surfaces with bleach wipes, wash your hands, and always think about vaccinations. Children 6 months and older should be vaccinated. In order to overcome the seasonal flu, we must all adhere to universal vaccination. Children 6 months and older should receive 2 shots of the flu vaccine, ideally 4 weeks apart. This is important in general to build a herd immunity and improve our community health.